Good evening to all. And what I'm going to do for the Raaonline webinar today is going to be a common and conscious problems. These are all common problems. These problems are going to disturb the consciousness of the patient, and we have to be conscious about these problems. That's why I put this as a common and conscious problems. And the first topic I'm going to talk to you is about the posture and BP. In this first topic is going to be orthostatic hypotension. I'm trying to give you some of the new views of a very old problem. This is not a new problem. This is a very old problem. And first of all, we define what is orthostatic hypertension. From this on, I'm going to call that as POSH, POHS. POHS is the POSH. So the orthostatic hypotension, or the POSH, is defined as a reduction of the systolic blood pressure at least 20 millimeters of mercury of systolic blood pressure, or a reduction of blood pressure of at least 10 millimeters of diastolic blood pressure in the first 3 minutes of standing. So this is called active standing. From the patient's lying position, he comes to the standing. It is called active standing. In those people who cannot stand themselves, then you can use a tilt table to get the patient up to the degree of 60 degrees. Then you check the blood pressure. You have to check the blood pressure every minute for 3 minutes. If the postal hypotension is within a minute, that means immediate orthostatic hypertension. It is evident this drop of 20/10 is happening around 3 minutes. It is called delayed orthostatic hypotension. There are two important causes of this POSH. One is the drug induced, like your vasodilators, like amlodipine or nifedipine, or any vasodilator, hydralazine used, or the nitrates. BP falls immediately within a minute. It is most often drug induced. And if the hypotension is going to happen around 3 minutes, little delayed, it is likely to be autonomic failure. So this is how first we have to diagnose orthostatic hypotension. Then we have to diagnose what is causing orthostatic hypotension. Supine for at least 5 minutes. So patient has to lie down for 5 minutes. Why this is so?